Hello, good afternoon, and welcome to this afternoon's virtual lunch meeting. My name is Alec. I'm the MD for Wound Care People. We are bringing you these series of virtual lunch meetings in place of what would be the traditional rep meeting, an opportunity for you to meet representatives from companies and learn about new products and innovations. And today's session, I'm very pleased to announce, is in partnership with MEDI. So we'd like to thank those for supporting the event. And this evening's session is called mTABLET, Assessing and Treating VLUs, a collaborative self-care in venous disease, introducing the MESI mTABLET ABI. I'm joined today by Kelly Buxey, clinical trainer for MEDI UK, and Katy Stevens, a tissue viability nurse for the lower limb service in Colchester, who will both be presenting. Ladies, how are you?
Good, thank you. Yeah, very well, thank you.
Excellent. So I know that you're very excited to get started. So I'll be handing over in just a second, but just a few bits of housekeeping for me. You'll see, as normal, we say this all the time of late, is that we're presenting from our workplaces and homes. So if there are any technical issues, if you can just please bear with us. Ask lots of questions. If you can, we'll be having a live Q&A at the end of the session. So in the comment box, you can ask as many as you like, and we'll get Kelly and Katy to come back to you with those at the end of the presentation. Certificates will be available to download for CPD. Link will be available via the end. Without further ado, I'm going to hand over to you, Kelly, to start the presentation, and I'll come back at the end for the live Q&A.
Fab, thank you, Alec. So yeah, good afternoon, everyone. And again, thanks for joining this lunchtime session. As Alec said, I'm Kelly Buxey, and I am one of the clinical trainers working for MEDI. And I'm really excited to be with you this afternoon to be able to share with you this new technology that we're going to talk about that you could think could be required within your service to improve the care and treatment you deliver within your service and for your patients. I'm really excited as well to have Katy with me, as she'll be sharing her experience, the experience she's had with the MESI mTABLET, what it's achieved for her service, but more importantly for those patients attending. And as Alex said, there'll be plenty of time for questions at the end, and me and Katy look forward to answering those questions. So obviously there's many barriers to the traditional ankle brachial pressure index measurement, and we know that there's a huge amount of research around these barriers and why at times this is not carried out. And their guest paper has published a lot of these barriers, and these come down to and can be seen as the skill mix required or the skill set required to complete this assessment. Not only just the skill itself, but acquiring those competencies that you need to be able to complete a handheld Doppler assessment. This again comes into a time element. Time to undertake the assessment itself and gain your competencies, but also linking it back to the rest time that your patient will need before that assessment. So traditionally a 20-minute rest period, and then undertaking the assessment on all 4 limbs. Again is another time element, which I'm sure all of you listening today, time is very precious within your services. Also, this can be seen as an unpopular task, probably because of what I've just explained previous about capacity and time to be able to undertake this. And sometimes it falls on those more experienced staff, which at times you might not have many experienced staff around to undertake it. So therefore, it builds up. Traditionally, you need multiple pieces of equipment to undertake this. And obviously on top of the equipment you're taking to treat your patient, you need lots of different hands to take that equipment in with you. Also, it can be seen as sensitive to human error when calculating. You've got your patients, family members with you at the time, could be talking to you, could distract you when trying to calculate that actual ABPI that you require. Also, patient compliance can be seen as an issue, home situation, and those patients that possibly can't lay down for long periods at a time. So we do have an element that patient compliance can be an issue for you to perform that ABPI. But we do know that performing the ABPI is a screening tool to exclude compromised arterial blood flow. And the reading is used in conjunction with a holistic lower limb assessment. And it's to determine whether there is any signs of peripheral arterial disease, PAD. But what it does do is allows you to make sure that the patient is suitable to have that compression, or the level of compression is correct for that particular patient. So I just want to remind you and just really sort of share with you, we need to remember that poor care costs the NHS a lot more than getting it right first time. So we need to avoid delivering what is seen as poor care. So how can this be achieved? Um, our main aim as healthcare professionals is to improve our patients' outcome. So we need to ensure that we apply this to those who are suffering with any form of lower limb problems. And to achieve this, there are a few main steps. And the most obvious is making sure that we can diagnose or that early detection of any concerns, and certainly particularly for your high risk patients. Um, so early diagnosis is absolutely essential. And next steps, obviously, if we can diagnose and know what we're dealing with, the patient can then be entered or put on the right care pathway for their needs. And this also is about collaborating with the patient and discussing the diagnosis, what this means for them to be able to truly understand their diagnosis and comply with the treatment that's most suited for them. And if this happens, we know that we're going to avoid any kind of serious consequence, because we need to avoid harm for our patients. We need to make sure the care is delivered at the right time by the right person, and we're delivering that right treatment to avoid any kind of harm, because this can be costly, not only to your service, but to the patient themselves and their quality of life. It's really important. But undertaking that diagnosis, that assessment, that holistic assessment identifies as well if the patient needs to be seen or referred on to another service, your specialist services, for further advice or support, or for further investigations. And we know that if all the above can be carried out, this will give the best outcomes for our patient. And by doing this within the right time frame, it will improve the care that you deliver. It will reduce the cost spent on venous ulceration, because we know this can be very costly. And most importantly, we need to make sure that we are delivering this all in a collaborative way, in involving our patients, their carers or relatives, because ultimately we need to make sure that the patient's quality of life is at the forefront of all the decisions and the healthcare treatments delivered to that patient. So the truth of it, the facts around the facts we see are very clear about lack of identification. We need to make sure that we are decreasing. We need to make sure that we're decreasing any harm. And we know from the facts here that 1.5% of the adult population have a leg ulcer, and this increases to 3% with the ageing practice population. We know that £5.3 billion is spent on wound care alone, and that a recent survey found that 40% of patients had not had an assessment and had not or did not receive a diagnosis. So I pose the question, if 40% had not received a diagnosis, how can we guarantee that treatment being delivered is correct? And 31% of patients that were diagnosed with venous leg ulcer was not receiving that optimal treatment. So that full 40 millimeters of mercury compression that is recommended to treat a venous leg ulcer. And we do know that there are inadequate resources, equipment available to people, and there is at times lack of training and education, and ultimately the lack of time that you've got to deliver your holistic assessments within your service. So in turn, what does this mean? There's inconsistency, there's variation in care being delivered across the NHS, and we need to actually change this and turn things around, because going back to that harm question as well, if we are delivering inconsistent and variation in care, we're running the risk that there is harm being delivered to our patients. So we know that technology is improving all the time and is actually being seen as a must these days, certainly within the NHS and healthcare services. But also we need it to meet our ever growing demand that we're all faced with. And I'm sure you can agree with this, with our recent current situation. We've all had to embrace technology due to COVID in many areas. For example, me presenting and bringing this education to you virtually. So improvements are needed more than ever to address the burden and demands that everyone is being faced with when it comes to lower limb problems. Therefore, I'm sharing this information with you today, as your service may be looking to make improvements to meet the demands and complexities that you're being faced with. And the MESI tablet could support you to make these improvements and provide you with high quality outcomes your service deserves and your patients deserve. So you're probably all familiar with the MESI ABPI, and if not, it's on your screen now. Many of you may already have this using it, or know that another area is using this. This is a great piece of equipment. It's portable, lightweight, user-friendly, and it provides you with a rapid, safe and accurate assessment of an ankle brachial pressure within a number of minutes, and just within a minute and just at a touch of a button. It provides you with the blood pressure and heart rate and your pulse waveforms readings. So today I'm sharing with you the newest generation tool, which is the MESI tablet. And you may all be asking yourself if the tablet supersedes the MESI MD. And the answer to this question is no. But actually, what it does do is offer you all the advantages of the MESI MD and many more functions that some services could benefit from managing their patients who attend. So we'll explore some of these features over the next few slides. So you can decide whether the MESI tablet is right for your service if you're looking to make those improvements and deliver care for patients that are possibly seen as more complex. So the MESI tablet, it offers a completely new concept and is designed for healthcare professionals who are looking for a certificated medical device that can offer multiple functions within that one device. Today, we are only talking about the MESI Smart Wireless ABI, TBI module, and the diagnostic tools and medical apps available in relation to the management of venous disease. But please be aware, there are many other modules and medical apps available that can be linked up to this device, offering you a multifunctional diagnostic tool within your healthcare practice. So please go and explore these. There are other functions that you may feel your service needs. And for example, those of you who may be from GP practice may be interested in the wireless ECG option that can be added onto the tablet. So I said to you we were talking about a few options, and here is the first. So it's the MESI tablet ABI. It is a family of a wireless diagnostic tool, and the tablet is the heart of the modules. So let me introduce you to the ABI function. As you can see, you've got your 4 cuffs, and this offers you a 1-minute automatic ABI option. You can also then access the blood pressure, the dual BP, the average blood pressure and the central blood pressure, and also those waveforms. And seeing it in practice on the screen, that you can see a picture now being displayed with the 4 wireless cuffs attached. Once these are attached, it is just a press of a button, and yourself, the practitioner, or those performing it will be able to undertake a 1-minute ABPI. assessment. And I think it's quite pertinent at the moment to say, because it is wireless, you've got no wires. If you wanted to spend less time with that patient, you can attach the cuffs to the patient and then step away, making sure that that social distancing is happening with the current climate that we're in at the moment. So some of the key features of the MESI ABI machine is that it does avoid any kind of human error, because it does give you that automatic reading. It is a 3-cuff simultaneous 1-minute measurement. And because of the smart arm detection, it will determine the higher blood pressure out of the 2 arms, and the 3-cuff simultaneous assessment will use that highest arm. You will see during the assessment, you can see the pulse waveforms, and you can access the oscillation graph on all extremities. And the benefit here is you can share these if you require any kind of further input or support or discussion with other MDTs to discuss the patient's most appropriate treatment plan. Um, there is the PAD sense algorithm, so it will alert you as well if there is some severe disease. The cuffs are pre-shaped, making it easier to apply, and these come in various sizes, and you can mix and match the cuff sizes if needed, depending on the limb circumference. Um, and then it does give you the option, moving on, to have the TBI module attached as well. And again, here on your screen, you can see the TBI module. It is wireless, as I said, provides you with the wireless TBI module, and again, providing you with a quick 1-minute automatic TBI assessment, as well as seeing the blood pressure functions alongside that as well. So here you can see on your screen a picture of it in action. The cuffs from the ABI would be left in place, and then you would attach the TBI module and remove the ankle cuffs. And again, this would allow you to then step away from the patient with the mTABLET and perform the 1-minute TBI assessment. And as with the ABI, there are key features. These key features, very similar, gives you that 1-minute automatic TBI without the need of prior resting. It's simultaneous measurements, takes the arm and the toe pressure, and it will give you that automatic calculation. One of the TBI also will offer you the graphs, and you will be able to see the PPG, so the photoplethysmography waveforms as well. We've got the LED sensor as well, so you will be able to check the temperature of the patient's toes. And the cuffs offer are color coded. Again, you've got different sizes for the toe cuffs, and they are disposable if that's what you require. You've got the option of disposable cuffs. And like I said, it's then that easy transition from conducting your ABI to a TBI, without really actually having to bring your patient back, book them another appointment. So again, time saving for your service, but also avoiding having to bring that patient back into your clinic for what could be seen as another sort of 60-minute to an hour appointment. 60 to 90-minute appointment. So I said I was going to speak about some other functions of the MESI mTABLET, and here on your screen is the photo app that comes with the device. Having this option at your fingertips enables you to capture possible skin conditions, photographing the wound itself, to be able to obviously send on to other specialists if needed, or your colleagues for some simple advice. And, skin conditions, you may feel that you need some input from the dermatologist, so you could send this on to the specialist to ask for advice. To be able to effectively set up a care plan that's appropriate for that treatment, for that patient. All of these can be saved within the patient's M records, and you can track the healing rate with these patients, or if it's a skin condition, you'd be able to refer back to this and involve your patient in this. So your patient could see the picture that you'd taken a few weeks prior, and then again see it today to see that healing rate and how effective that treatment plan has been. You can also print the option is to save these within your patient's medical records. You can print them off or share them via email, and the patient might want to have a copy of these. So great, I think, for making sure if you feel you want some input from specialists, this is a great option to be able to get that. But also likewise, if you want to refer a patient onwards, the pictures or the email could be sent, and the specialist receiving it could use this as a triage process instead of having to bring the patient in and see them, because all the information could be sent to them. So another great function, and that comes with every mTABLET, is the Hosiery Hunter app that is added. And what this does is it really enables you to make sure that your patient is truly getting patient-centered compression, because the Hosiery Hunter will allow you to then select the signs and symptoms that that patient is presenting with. And to me, we're talking about collaboration and working with our patients. This is a really simple tool that you could share with your patients for them to be able to address the signs and symptoms that they've got on their leg. And then you would move on to enter in the patient's BMI, their limb shape, enter the ABI or TBI measurement, and the limb measurements itself. And at the end, the hosiery, at the end of completing all this, it will provide you with the correct or options of what correct compression should be used for that patient with those signs and symptoms, that limb shape, to make sure that they get the right compression for that patient, the right style and fabric. And to me, I see this as a great learning tool for perhaps our junior members of staff or those that are learning, to make sure that the patient is provided with the right treatment for that particular limb that you're assessing. Also, another added advantage of this is that this can be then sent to the prescriber. All the information that the prescriber would need to put on the prescription can be emailed to them. Again, avoiding any kind of human error, making sure that that patient receives that correct garment. And it will be saved within that patient's M records. So if there is any query over anything, you can go back into that M record for that patient and look at what hosiery was requested for them. So great function there. So just to sort of summarize the concept really of the mTABLET and this technology, a nurse can be at the bedside with a patient, attaching the wireless cuffs to that patient and perform the assessment required, stepping away to make sure social distancing is achieved. And then the functions they've got available is to save that within that patient's M records. They can print it out if it's attached to a printer. So if that patient would like that results, but also a colleague in another room, or the doctor that's requested it, who has access, who's been given permission to access that M record, can also access those readings to be able to make sure that the right care and treatment is being delivered. That can be sent onwards as well to specialists, as I said, but also then can be uploaded into that patient's records itself. So again, just reiterating that it can be saved within the patient's M records. It can be printed out and saved. When it's saved, it will be saved as PDF and uploaded into the medical records. It can be shared by email, or there is an option to print out the results. So using the ABI and TBI, it gives you a complete arterial assessment. avoiding you to having to book that patient back in for a further assessment, and is all completed within a matter of 2 to 3 minutes. Your ABI is a 1-minute automatic assessment, and your TBI is a 1-minute automatic assessment. It's quick and easy to use, and the results will be displayed on the mTABLET or within a report. So the ABI will provide you with the navigation bar, and it will give you the numerical results. And then you've got the reference scale. So again, for your more junior members of staff, you've got your reference scale to refer to. It will provide you with your pulse waveforms. And most importantly, if this is an assessment down the line, if you've done previous assessments, you'll be able to access the history of this particular patient. Or if there is a deterioration, you will be able to examine the previous assessments. So this is your TBI results, how these will be displayed. And then you've got your, sorry, that was ABI, and then you've got your TBI. And the difference with your TBI, you will see your PPG waveforms. So very clear and straightforward results, avoiding any kind of confusion of results or misreading results. And again, these are reports that can be sent off to any kind of specialist MDT if you require any further support or assistance. So just to summarize, really, we know that the mTABLET can facilitate and improve the treatments that you are required to deliver to your patient, and in turn will see great outcomes, positive outcomes. It will release time for you to be able to deliver that more collaborative self-care approach, being able to deliver education to your patients, undertaking that 1 to 2 minute actual ABI, TBI assessment will give you that time to educate your patient. And again, just reiterating, the automatic reference scales prevents any misunderstanding of results and is saved within that record and can be uploaded into the patient's medical records themselves. It's quick and easy to use. And then, as I said at the start, there's lots of other options, potential modules that can be added. The MESI mTABLET offers you the 12-lead ECG, the pulse oximetry, spirometry, and there are other apps that can be added. So please do go away and explore these options, or come back to MEDI and we'll can quite happily share these other options with you. So we always want to make sure that we are delivering safe, effective care to our patients, and the mTABLET can enable you to deliver that and support that vision. And I'm going to hand over to Katy now, who is going to talk about the vision, using the mTABLET and how it's worked within her service. So Katy, over to you.
Hi, Kelly. Thanks for that. Yeah, I just wanted to say what the mTABLET does for us really in practice. So the mTABLET is new for us, but it's really improved our outcomes for patients by allowing us to, as a service, to quickly and accurately obtain an ABPI in a matter of minutes. By taking less time to perform the ABPI, it gives us the opportunity to holistically assess, empower and educate our patients. We have found that the more that you can support the patient, the more likely patients will follow recommended best practice. The mTABLET allows us to use a wireless, easy, clean system to obtain our ABPI, including visual waveforms and an application to take pictures of the wound rather than going between equipment. This can all be uploaded instantly to our patient record, and we can forward full reports to other specialist departments such as vascular. The NHS long-term plan sets goals for us to move to a digital age with collaborative working to ensure best outcomes for the patient. So there's just a picture, as you see, the mTABLET in action. So within our service, we've had great success with delivering supportive self-care and improved healing rates and low reoccurrence of ulcerations. We deliver this by ensuring a detailed holistic assessment on triage. We provide education regarding venous disease, what it is and how it relates to that patient's concern. We explain they will be given the latest advice on how safely and effectively they can manage their own condition. When it comes to patient assessments, we already have discovered possible barriers to healing and what type of condition we're expecting to see in clinic: venous, arterial, edema management, or a combination. And we already have a plan in our minds. This enables us to reinforce education and empowerment at the face-to-face assessment, focusing on the patient as an individual. By using the mTABLET, we've been able to accurately and quickly obtain the ABPI and assess the waveforms for our more complex patients. We're able to take the pictures, which is essential to monitor the progression of the wounds. This then leads us to the Hosiery Hunter, great for confirming the correct hosiery choice. If patients are not given the right hosiery for them, there's a high possibility their condition will not be managed correctly, or they will not want to wear it, and then often being labelled non-concordant. We're also able to write notes alongside this initial assessment, upload it to our patient records, and email the assessment to the specialist service such as vascular. We then give all of this in writing in a supportive self-care booklet for the patient to take away and read. There's a picture there of the supportive self-care booklet. So an example, in October, we had 25 face-to-face appointments within clinic. Due to our robust triage, ensuring we delivered education, empowerment, and a holistic assessment, we were able to Doppler 25. 13 were able to take part in supportive self-care in hosiery. 5 were discharged with advice regarding skincare and hosiery. And routine Dopplers were booked in 6 months. The rest were managed in clinic in bandage systems. All of our patients received the MEDI supportive self-care book, again providing education regarding their condition. So the focus is on more now than ever with the National Wound Care Strategy and also the sequence upon us that patients with venous disease need to receive the most up-to-date evidence-based practice of care to ensure best possible outcomes. This is the start of our mTABLET journey, but it puts us in a good position to be advanced in our assessments, especially with the future additions such as the TBI for our complex patients. Eventually, we will be able to use systems with protocols to ensure sequence are met and gold standards of care are delivered across the board. And finally, with the technology and apps available, we can provide an efficient, effective service that ensures a collaborative approach with the patient, with their relative, caregivers, and the wider MDT team to ensure high quality care is delivered and unnecessary harm.
Thanks, Katy. Katy, can I just ask you, can I ask what value you see in having the TBI module with the mTABLET?
I can definitely see a value with the TBI, especially when it comes to our more complex patients. So sometimes we have patients in clinic where we just simply can't obtain an ABPI due to, edema or overinflation of the cuff when they've got high venous pressures. And often we then have to refer to vascular and wait quite a time for them to be seen for a duplex scan. I think if we had that fast 1-minute TBI assessment, we would be able to achieve our arterial assessment, and then the patient would then have optimal care rather than being in a reduced compression, which would lead to delayed healing without that initial assessment. So yeah, I definitely feel it would be beneficial because you can do it all in one appointment. If we can't get a Doppler right now, a Doppler reading, then we end up having to bring them back another time and trying something else or waiting on a specialist service.
Okay. And then you refer to you saw 25 new patients within the month of October. Do you think this would have been as successful if you didn't have the mTABLET?
I think definitely our outcomes would be different. As we all know, with nurses, we're so stretched for time, and anywhere we can save time by having, a really fast ABPI, it really lets us focus on the patient as an individual and really overcome those barriers to healing. We really get to know our patients, rather than, with our head downs for a long time trying to get those readings. We can really interact with the patients.
Yeah, thank you. And then you talk about standards and guidelines, and certainly with the National Wound Care Strategy Programme and the recommendations and the sequin. Do you feel that the mTABLET can support these recommendations and these standards?
Yeah, definitely. So I feel technology is the way forwards. There's many functions that I look forward to adopting and using, like the protocol app. That would be great if we could embed, the correct guidelines within the assessment tools so that they're always followed for every single patient. They don't vary. These patients get the recommended gold standards of care at every single assessment, and also, with the minimum data set of the sequins to ensure that we are hitting those so the patients get the best outcomes.
That consistent approach.
Definitely.
Across. Okay, just to summarize, Katy, if you had a few words for the audience that are watching us or listening to us about the mTABLET in terms of its ability to support that assessment, that diagnosis, and delivering that collaborative approach, what would be your few words that you'd be saying to the audience today?
So again, I can only share my experience so far, but by having a faster assessment and accurate, and having it all in one place, enables us to really focus on the patients. I can only imagine it will save us more time and money as well. Giving those timely assessments so that we can support those patients that really need us. I look forward to it being part of a more preventative program. Already we are, as a service, receiving referrals where patients have early venous signs. By these being detected sooner could cause, well, for patients not to have unnecessary leg ulcers by recognising the early signs and symptoms of venous disease. But it's really exciting to be able to deliver optimal treatment for these patients to ensure best outcomes, and also by being able to create a sustainable onward service.
Thank you. Thank you for sharing that with us, Katy.
You're welcome.
And I'll thank you everyone for listening, and me and Katy look forward to any questions that you've got for us.
I was muted then as I came back. Katy, Kelly, thank you very much for that. I found it very interesting, and I've been following the comments and questions via the Facebook page, and we've had lots of those come in. So we'll get straight onto the questions because we've had so many. And the first question, which is for Kelly from Alison, is evidence papers from the VLUs say it is important to take all 4 limb pressures for ABPI calculations. What is your opinion, as the MESI takes 3 limbs only?
So the MESI mTABLET is taking assessment on 4 limbs because it is using detecting the higher blood pressure out of the 2, and then it kicks straight into a 3 cuff simultaneous assessment. So the mTABLET does provide you with that option. If you are concerned about a variation in a blood pressure, if using the MESI MD, you would then undertake a blood pressure on both arms and use the highest of the 2. So there is that option with the MD to undertake a BP on both arms, but with the mTABLET, the smart cuff picks up that highest. It will still perform a blood pressure on both arms, and then it kicks straight into a 3 cuff simultaneous assessment.
Okay. Excellent. Thank you very much. Hopefully that answers your question, Alison. Question 2, which is for Katy. Do you use the mTABLET in clinic, or do you also take it out to patients' homes?
So both, actually. So we use it in clinic, and I've used it for patients outside as well. I like to use it for all of my patients because I get that real detail with all the waveforms and everything really, and just like to be able to upload it to my patient records. However, we use the MD still as well. So some of our band 4s will go out and do our routine Dopplers with the MD, but I really like to use the tablet because it's just so quick and easy to clean and no wires.
Excellent, thank you. So would you say that, have you seen an increase in ABPI measurements being taken since you've used the device? Have you?
Within our service?
Yeah, within your service.
So first assessments for all of our patients, they all have an ABPI. That is what their first assessment is all about. We wouldn't not be taking an ABPI. The only time we don't have the result is when we can't physically get that result because of something more complex going on. And that's where I see, like the TBI, and Kelly has demonstrated the TBI with us, and it's been amazing that we've had these patients that are waiting for vascular, and we've been able to give them optimal compression just from getting that reading.
Well, that actually leads us quite nicely onto the next question, which is for you, Kelly, from Leslie. And this is, can the TBI attachment be added to the MESI MD?
So no, it can't. The MESI MD only provides you with an ABPI. And it's the new MESI mTABLET that gives you the wireless TBI option.
Okay. Question 4 for Katy from Alison, which is there any type of patient or situation where you would not use the MESI?
I haven't, so I've been able to use it on all of my patients. I can't think of, unless you, unless it one of those patients where red flags, with like the National Wound Care Strategy guidelines, if it was one of those, we may not do that assessment because they're not suitable for that. There's something more urgent going on. But no, we've been able to use it on all of our patients.
Excellent. I guess, Kelly, probably the same question for you then, because are there, in terms of the instructions for use of the devices, are there any patient groups perhaps where it's not recommended?
So it'd only be those that would be your national recommendation, so active DVT that hasn't been treated. Again, it's down to that holistic assessment. Our aim is to undertake that arterial assessment. And this is just an aid and supporting that holistic assessment. You've got the functions for the amputation. And I would say, again, if someone's had any kind of surgery to their upper arms, limbs, or got a lining, you would avoid that particular limb and just use the limb that hasn't got, say, had any surgery, if someone's had breast surgery, etc. So no, it would be down to that collaboration with you and that patient, and about what's the risk of not doing it to doing it, really. Okay. That risk adverse.
Yeah, and that sort of leads us onto our final question. Before I ask this, I will just remind people that we've had lots of questions come in today. So if we haven't managed to get through to your question, the edited version of this video or this event will be available via our website from tomorrow, and within a few days we'll have a document which has all of the questions with responses to them. So we will actually get back to all the questions that we didn't get a chance to answer today. Final question for this lunchtime, which is for Katy from Lauren. Can the mTABLET be more tolerable for those patients who struggle with the pressure and pain of their legs?
So I think that's where the TBI could come in. So some patients we have had which haven't used this on, where they just say that the pain is too much to have the inflation of the cuffs, then we could always do a toe Doppler. And I would be asking Kelly to come and support us with that.
Brilliant. Okay, well, Katy, Kelly, thank you very much for the presentation today. Like I said, based on the comments that we've seen and all the questions, it's certainly been something that people have been very interested in. Thank you, everybody, for joining us for today's lunchtime virtual lunch meeting. You should have a link to download a certificate of attendance available on your screen now, along with some contact links so that you can contact MEDI directly if you've got any questions about anything that has been presented today. Do join us for our future events, like our Facebook page, and share it. And we look forward to seeing you all later. I'm off to go and get myself a cheese toastie for lunch.
Thank you.
Bye all.
Thank you.
Bye.
Bye.